Hernias are a common medical condition that can affect people of all ages and backgrounds. They occur when an internal organ or tissue protrudes through a weak spot in the surrounding muscle or connective tissue. In this comprehensive video, we will explore the different types of hernias, their causes, symptoms, and most importantly, how to prevent them, especially when lifting weights and through targeted exercises. This is the only video you want to see till end to know about hernias and how to prevent its occurrence, so keep watching. Types of hernias. There are many types of hernias, every type having their own set of signs and symptoms. Nearly all of the hernias need surgery at some point. Inguinal hernia. This is the most common type of hernia and occurs when a portion of the intestine pushes through the abdominal wall or into the inguinal canal in the groin area. Inguinal hernias are more common in men and may cause discomfort, pain, or a noticeable bulge in the groin. Femoral hernia. Similar to inguinal hernias, femoral hernias also occur in the groin area. However, they are more common in women. They can lead to pain and discomfort and may require surgical intervention. Hiatal hernia. Hiatal hernias occur when a portion of the stomach pushes through the diaphragm into the chest cavity. They can cause acid reflux, heartburn, and chest pain. Umbilical hernia. These hernias develop around the navel or belly button. They are often seen in infants but can also affect adults, especially those who are overweight or pregnant. Incisional hernia. Incisional hernias typically develop at the site of a previous surgical incision. They occur when tissue or organs protrude through weakened scar tissue. Epigastric hernia. These hernias occur in the upper abdomen, usually between the breastbone and the navel. They are often made up of fatty tissue and can cause pain and discomfort. Causes of hernias. There are many causes of hernias. Hernias can develop due to a combination of factors, including weak muscles, heavy lifting, chronic coughing, obesity, and pregnancy. Due to aging, the muscular lining gets weaker, causing the rupture of the layer that protects the bowel at any point, needing surgery. Symptoms of hernias. The symptoms of a hernia can vary depending on the type and severity but may include a noticeable bulge or lump, pain or discomfort, pressure or a feeling of heaviness, and heartburn or acid reflux in the case of hiatal hernias. Preventing hernias. Prevention is better than cure, as it is said. Make sure that you strengthen your core by doing exercises that target abs and core. Preventing hernias, especially when lifting weights or engaging in physical activities, is essential for maintaining good health. Here are some strategies to reduce your risk: proper lifting technique, maintaining a healthy weight, strengthening abdominal muscles, avoiding smoking, managing chronic conditions, staying hydrated, and wearing proper support during strength training exercises. Exercises to prevent hernias. There are a couple of exercises that can be effective in preventing hernias by strengthening your core and supporting your abdominal muscles. Plank exercise. Start by lying face down on a mat or the floor. Position your elbows directly under your shoulders and prop yourself up on your forearms. Engage your core muscles, keeping your body in a straight line from head to heels. Hold this position for as long as you can, aiming to increase your time gradually as you become stronger. Be sure to breathe steadily throughout the exercise. The plank exercise is excellent for strengthening the muscles of your entire core, including your abdominal muscles, lower back, and hips. A strong core provides better support to your abdominal wall, reducing the risk of hernias. Leg raises. Lie flat on your back on a mat or the floor. Place your hands palm down under your hips for support. Keep your legs straight and together. Slowly raise your legs off the ground, keeping them straight, until they are perpendicular to the floor. Hold this position briefly, then lower your legs back down without letting them touch the ground. Repeat for a set of 10 to 15 repetitions. Leg raises are effective for strengthening your lower abdominal muscles, which play a crucial role in supporting your pelvic region and preventing inguinal hernias. Hernias are a common medical condition that can cause discomfort and pain. Understanding the types, causes, and symptoms of hernias is crucial for early detection and intervention. By adopting preventive measures, including proper lifting techniques, maintaining a healthy weight, and strengthening your abdominal muscles, you can significantly reduce your risk of developing hernias and lead a healthier, more active life. Always consult with a healthcare professional for personalized guidance on hernia prevention and management.